Welcome, everyone, to a brand new webinar with Maragh Dermatology. We are here to announce our brand new treatment, UltraClear. This is our virtual launch event with the one and only Dr. Sherry Maragh. If you have any interest in laser treatments or in rejuvenation, we're going to explain what this laser is all about, what it can be used for, and why you might consider it over other treatments. And most of all, why we're so excited for this new device. Before we get started, let me introduce you to our wonderful speaker. I'm pleased to introduce Dr. Sherry Maragh, who is a board-certified dermatologist and the National Aesthetic Medical Director at Advanced Dermatology and Cosmetic Surgery. She's a nationally recognized leader in advanced laser technology and minimally invasive cosmetic procedures. Dr. Maragh, the floor is yours.
Thank you, Holly, and welcome to everyone. We're very excited to have you with us this evening to discuss the UltraClear laser technology. I am a board certified dermatologist. I specialize in cosmetic dermatology as well as cosmetic surgery. And I have been practicing in the Maryland, Northern Virginia area for a little over 20 years now. We're very excited about the UltraClear technology. We have been using this device for almost 2 years now. And the most exciting thing about this, we have a lot of laser services that we offer, a lot of cosmetic things that we offer across our practices. We have an office location in Rockville, Maryland. We have two in Northern Virginia and Ashburn and Warrenton, Virginia. And we have a very diverse patient population. We see patients of all colors. We see patients in their early 20s. We see patients in their late 60s, early 70s. We see the whole gamut. And it has been very exciting to have this laser technology with UltraClear that we're able to serve so many different patients and treat so many different processes. So we're going to dive right into this evening and educate you about the UltraClear technology, and you can decide for yourself if this is right for you. Some of the things that we use our UltraClear technology for, I'm going to start our slide presentation here. So
Yes.
this is a little brief introductory video that tells you about the UltraClear technology. I'm going to play this. It takes about a minute and a half, and then we'll get into conversation on the other side of this.
The first. The first of its kind. Cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs. Balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass. Delivering each pulse to the exact depth with precise timing. Minimizing risk and pain. Allowing faster healing with optimal results. Keeping patients safe from discomfort and side effects. Something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Okay, so you can see here from that brief video that the UltraClear laser is a new revolutionary technology. It allows the delivery of laser services to a wide range of patients for various different things. We can use the UltraClear technology for evening out texture and tone. So that means that we can use it for pigmentation. We can use it for skin laxity and skin tightening. It can be used for very fine lines and wrinkles on the skin, and it can be used for much deeper lines on the skin. It actually delivers results that we have a certain patient population that may be looking for surgical alternatives. Well, the UltraClear technology is able to be aggressive and gentle enough to deliver similar results to a mini facelift for certain patients. Also, the UltraClear technology can be used for the treatment of acne scars. It can be used for the treatment of post-surgical scars. So we've seen many patients, if they've gone through reconstructive surgery, whether it's abdominal reconstructive surgery or breast reconstructive surgery, we've gotten very excellent results with resurfacing of scars with the UltraClear laser. something as simple as sun damage spots when we get the little brown splotches and things like that on the skin just from spending a lot of time in the sun. The UltraClear technology can help with that. And it can help with just overall skin rejuvenation. And as you heard in the video, it uses the cold fiber laser technology, and we're going to get into that a little bit, that makes the delivery of the laser energy much more safe than a lot of the laser technology that we've dealt with over the years. And we've really had to be very cautious in who we offer the service to and what things that we can treat with it. So now we've really broadened who can get the service, who can get this particular service, and what we can treat as well. So, why patients choose this particular laser? You have so many different options when you're trying to decide what laser you're going to use and what you're going to treat. Some of the benefits of the UltraClear laser is that it provides comfort without compromise of the results that you're getting. So you can get a very aggressive laser treatment without having a lot of pain and discomfort and downtime. And the good thing about the UltraClear is that there are various levels of treatment. You can get a very superficial treatment to give you some light refreshing, and then you can get a very deep, more aggressive treatment. It all depends on what the patient is looking for and what they're looking to correct. The treatments offer an all-in-one solution in the fact that you're getting treatment of texture, tone, and pigmentation all with this one laser device. So with one treatment, you're able to treat pigmentation, you're able to treat the fine lines, you're able to treat skin laxity. So you really can receive a full comprehensive rejuvenation of your skin just with this one laser device. Whereas years ago, we were combining things. We were combining our CO2 laser, we were combining our IPL laser, we were putting all these things together to deliver the same results that this one laser service can deliver. Quick and convenient treatments. So as I mentioned, you can get a very superficial treatment that is almost like a lunchtime peel. That is a very quick 15-minute in and out type of treatment. And then the more aggressive treatments, of course, do require more time. And we'll get into downtime and healing and what things look like when they're healing as well. Also, there's versatility in the treatment areas. So as I mentioned, this laser can be used for post-surgical scars on the body. So we have a lot of patients who come in and they receive treatments on the body. We treat acne scars on the body. We treat keloids on the body. We have a lot of applications for this laser that are not just on the face, but on the body as well. So that also allows us to offer this particular device to a much larger audience. So, who has the right skin type to receive a treatment with this particular laser? As we mentioned before, very versatile and very safe. This laser can be used in all what we call Fitzpatrick skin types, and Fitzpatrick skin types are how we describe skin color. So, Fitzpatrick skin types range from type 1 to type 6, depending on how much melanin is in the skin. So we have our patients who are of the darker Fitzpatrick skin types, which we consider skin of color, and that is anywhere from type 3 to type 6. And in that particular patient population, there's oftentimes an increased risk that is carried with getting laser treatments. There's always that risk of scarring, there's always that risk of post-procedure hyperpigmentation, and those things can be very hard to manage. The UltraClear technology with the cold fiber technology, which is decreasing the heat that is delivered to the skin during the treatment, allows us to safely treat skin of color, Fitzpatrick skin types 3 through 6, while still offering very aggressive treatments to fairer skin types who before really sometimes felt that they could only get a really good treatment if it was a very aggressive laser with lots of downtime, lots of scabbing and crusting and bleeding and so forth. But now, even with our Fitzpatrick skin types 1 and 2, they can receive a very aggressive treatment, almost very similar, like I said, to mini facelift type results, particularly in the lower face, the jowl area, and onto the neck with the UltraClear technology. Now, there are 3 levels of treatment. We call the levels of treatment 3D Miracle, UltraClear, and laser coring. With the 3D miracle treatment, that is the quick and easy treatment. That is treating the top superficial layer of the epidermis, which we call the stratum corneum. That is a treatment that requires maybe 15 to 20 minutes, a little bit of light topical numbing to the skin, and it really does give you a nice fresh glow to your skin. So for our patients who say, you know what, I have a reunion coming up, I have a big party coming up, I have a wedding coming up, I need something that's going to not be a lot of downtime, but offer me some nice refreshing to my skin. The 3D Miracle treatment is perfect for that. And again, for all skin types. I've had the 3D Miracle treatment before. It gives your skin that nice, pristine glow. It shrinks the size of those pores for you. It gives the skin a nice, soft, dewy appearance. Those treatments can be once every 4 weeks, and we'll get a little bit more into this later on in the talk. But you can get one of those treatments. You can get three of those treatments. You can get as many as you like, but it really does give the skin that nice, fresh glow while still addressing some of those very fine lines and pigmentation in the skin. So it's not just a fluff type of thing. You're really getting a significant result with a procedure that's not giving a lot of downtime with the 3D Miracle treatment. Once we get into the ultra clear mode, we're taking that 3D miracle treatment of the epidermis, we're getting a little deeper into the epidermis, and then we're also getting into that superficial layer of the dermis. So now we're dealing with a little bit more deeper lines. So not just the fine lines, but really dealing with some laxity and trying to work on jowls, trying to work on our nasolabial folds, skin laxity of the lower eyelids, a little hooding on the side of the eyelids. So we've gotten a little deeper with our treatments now. This has a little bit more downtime associated with it, but you're also going to get a lot more anti-aging with this treatment, really dealing with a lot of acne scars, those dermal pitted scars. When people say, you know what, my acne's gone, but I'm really bothered by the fact that I still have these residual pitted scars, and I want to enjoy my clear skin, not just with my acne being gone, but also with my scars being improved. So the ultra clear modality, that particular mode of the laser is very useful for that. Again, for patients who are looking for a more natural anti-aging, say, well, I'm not really ready for fillers yet. I'm not really ready for Botox yet. What can you do to make my own skin better? The ultra clear setting of this particular laser really does provide so much improvement in your natural skin quality and texture for rejuvenation. And then with laser coring, that is combining all of these modalities and really getting deep into that dermis to get some true face lifting. So we are getting significant lifting of the jowls. We're getting significant lifting along the neck area, upper eyelids. So really giving the skin, we've all stood in the mirror before and kind of pulled up on our skin and say, oh, we really want that facelift effect. This is showing you how much tightening you can get. And that will be with the laser coring modality. So with the 3 levels of treatment, this is showing you what you can achieve with that. So with the very superficial 3D miracle treatments, you're going to have that nice, healthy glow to the skin. You're going to improve texture and tone. You're going to improve sun damage as well. You are going to have a little bit of minimal downtime, nothing that you have to hide out for, and this is safe for all skin types. We get a little deeper in the skin. We're taking that 3D miracle down to what we call a clear treatment. So it's going a few microns deeper in the skin, and we're also getting into that dermis. Here we're hitting everything. We're really hitting hard on those fine lines, the deep wrinkles, and the acne and other post-surgical scars that we mentioned. This is going to give you a good 3 to 5 days of downtime, and we'll show you some photos of exactly what we're talking about with that. And again, safe for all skin types. So we can hit all of these things from a nice healthy glow to significant improvement with deep wrinkles for all Fitzpatrick skin types. So that means skin of all colors. And when we say skin types, we don't just mean color. We're also talking about our patients who may have sensitive skin. This laser can be dialed up or dialed down according to your skin sensitivity as well. There are a lot of patients who can't tolerate very harsh procedures or even very harsh products on their skin. And that is one of the very nice options with this particular laser is you're able to dial it into those things as well. And with the very advanced treatments that include laser coring that are going much deeper into the dermis, we're going to have more downtime there. We're going to have some more healing time. These treatments can be used in our darker Fitzpatrick skin types with caution. Sometimes we are using particular creams that help prevent hyperpigmentation. They can be very safely used in skin types 1 through 3, but when we go beyond that, we are exercising some caution and using things to prevent hyperpigmentation. This is just giving you a little brief overview about the company itself, Aclaro, and how it has developed this UltraClear technology over the years. Laser has come a long way since the early 90s, and when this laser was first FDA cleared in May of 2024, we started to use this laser actually just a few months after that, and we've been using it since that time. This short video here is just going to give you an idea of how that laser technology is going into the skin. It is delivering these layers, these columns of energy into the skin, causing a gentle heating of the epidermis and dermis. And that is what is stimulating our fibroblasts, our collagen producing cells, to create new collagen. With those little, what we call micro injuries into the skin, we are forming new collagen. So there's so many services that we offer in cosmetic medicine where we're putting things in you. This is allowing your own skin to improve itself. This is making your skin better, both on the surface as well as underneath. With the technology of the UltraClear laser, it is decreasing downtime and decreasing the risk of side effects with the cold fiber laser technology. And this is a brief video here that shows you how the treatment is delivered. And we're going to play this now. And we put eye shields over our patients when we're doing the treatments. We can get very close around the eyes to deliver the treatment. So we can still treat the crow's feet. We can treat the fine lines that are directly underneath the eyes. And you can see here, the skin turns a little red around the areas where the laser pulse is delivered. And the laser is delivered in a grid-like pattern onto the skin. These areas will form into a light gray or a light brown crust, depending on the color of your skin. And then those crusts will slowly peel off over a 3 to 7 day period of time after the laser treatment. If you have a deeper, more aggressive laser treatment with the laser coring, there's a little bit more healing involved with that. But as you can see in the video, the patient is relatively comfortable for the procedure. We do sometimes use a little bit of cold air to blow onto the skin, and it's really, it serves as a distracting mechanism, but also helps to keep the patient comfortable and helps to keep the skin cool while we're delivering the treatment as well. So you can see here, the entire face can be treated, and this is what allows that nice lifting and tightening of the skin, treating along the jawline, treating around the periorbital skin, where we get our crow's feet and things like that. So there's really no place, face and neck, that are off limits for photo rejuvenation. And then there are multiple areas on the body where we're able to deliver treatments for scarring as well. So this gives you a good idea of what the treatment is like when it's delivered. And this is showing you how there's a little bit of pinkness to the skin immediately after the treatment. And we are going to play this video.
So 2 months ago, I had my first treatment. Absolutely no pain, no recovery time. I was a little reddish pink, maybe for a day, and that was it. And the results were great. And this time, 2 passes, absolutely no pain, and I can't wait to see what's next.
So that's a little patient testimonial telling you her experience with the laser. And it's always good to get someone else's perspective and see what the laser treatment was like for them. Sounds like she had one of the 3D miracle treatments, which is one of the more superficial treatments, gives you very little downtime. It's so nice to see that skin sloughing off and to see that nice, fresh, dewy glow on your skin as you're healing. So as she mentioned, just a few days of downtime. I did this treatment, I've done it a few times now, but I did this treatment most recently on myself in March. And I did a more aggressive treatment. I did a really aggressive treatment. I wanted something that was going to give me some nice tightening and smoothing of my skin, a more natural photo rejuvenation, as opposed to really relying a lot on Botox and fillers and things like that. We love those things and we like to use those things, and we incorporate them in these treatments. And oftentimes that gives us a really good overall improvement when we incorporate those things. But I did my treatment, and I'm going to share my photos with you. So this is what I look like on day 2 after I had my treatment done. Of course, my skin is a little bit more brown, so my crusts appear more brown on the skin. I did a very aggressive treatment on my under eyes here because I really wanted to tighten that skin. I was noticing that I was also getting some darkness under my eyes, so I really wanted to work on the pigmentation as well. This is what I look like 3 days after the procedure. So as you can see, the crusts have started to lift from my skin, still a little bruising. And to note the bruising that I have underneath my eyes here, I actually did a little injection numbing here. So it's really more from the needle than it is from the laser. But a little bruising underneath the eyes. By day 3, my crusts are peeling off. By day 4, most of the crusting is gone. I still have a little bit of residual crusting around my hairline there. But then by day 7, again, as I mentioned, your skin has that nice dewy glow to it. The bruising is almost completely resolved in that area. And again, as I mentioned, that's really more from injection than from the laser. But this, I was very pleased with my result. Definitely something that I would do again. So, getting a little bit more into the details of the different types of treatment, the 3D miracle treatment, which we consider the most superficial treatment. These are some before and after photos showing what the laser is capable of. So here you can see a patient who has some moderate photo damage here and also some fine lines that you'll notice. And this is after one of the very, very superficial treatments. So this patient may have about 3 days of downtime. So this is someone who can come in for a treatment on a Friday and be ready to go back at it on Monday. This patient, we would recommend, of course, to have more than one treatment. We would package these treatments in a package of anywhere from 3 to 5 treatment sessions, depending on what their overall goals of skin improvement are. Of course, we're going to also have them on a very good skincare regimen where we have them using the important things, their vitamin C's, their retinols, glycolic acid, hyaluronic acid, all of the good things that we use. It is so important to remember that when you're considering laser treatment, that's an investment in your skin and your skincare. So you always want to make sure you're using the right products along with your laser treatment. And again, we talk about combining treatments. So our patients who come in for treatments like this, sometimes we may decide, okay, well, we're going to treat into the frown lines with a little Botox. We're going to treat into the forehead with a little Botox. But here you can see a significant, nice lightening of her brown spots over here. You see those fine lines around here with her crow's feet improvement. And this is just 4 weeks after one treatment. So this isn't something that you're waiting several weeks to see your improvement. Your improvement is pretty immediate. And you can also see here some improvement in these fine lines on the nose, improvement of some of these periorbital lines around the mouth as well. And in this photo, you see a much younger patient who's coming in for treatment of acne scars, blemishes, and pores. So you can see a significant improvement in the size of the pores. So this laser does help with shrinking the appearance of the pores and also improving acne scars. And again, this is one treatment, 4 weeks later. So you can imagine doing a package of treatments where you're doing 3 treatments, 4 treatments, 5 treatments, you're getting significant improvement. But even after just one treatment, these are the kind of results you see. A brightening of the skin, improvement in the appearance of the pores, improvement in the appearance of this dusky discoloration as well. And here, the same thing. This is a person who has a significant amount more of sun damage. We call these little sun freckles lentiginous, these little brown splotches on the skin. And this is just from normal wear and tear over someone's life. You know, you've been out in the sun a little bit, you're fair skinned, maybe not the best user of your sunscreen in your earlier years. You've accumulated some brown spots on the skin. You're not everyone isn't into a 12-step beauty regimen of putting lots of creams on. I want to come in, I want to get one treatment where I'm going to get some significant results. Again, this is the most superficial of the treatments, and even with the most superficial treatment, 4 weeks later, these are the kind of results this patient has here. So very significant improvement with pigmentation on the skin. And again, here, an overall improvement in the overall tone of the skin here. You can see that there is red discoloration here. There's an oiliness, there's the pores and so forth here, and you see a significant improvement in the skin here. This is a person who has a significant amount of sun damage on the skin and hyperpigmentation just from sun exposure over the years. And this 3D Miracle, again, superficial treatment. This is the most superficial of the settings. 5 weeks after one treatment, significant improvement in the pigmentation. And a patient like this could also consider doing one of the more aggressive or the deeper treatments that would also address these lines in the neck. So this patient would have the option of not only just doing the 3D Miracle, but if they were looking for a more aggressive improvement, they could also have these lines increases in the neck treated as well with the UltraClear technology. And we'll look at some photos before and after of representations of that as well. So going from the superficial 3D Miracle treatment, now stepping things down, getting a little bit more aggressive and also more results. This is a patient, Fitzpatrick skin type 5 patient who was concerned with almost like a chicken skin appearance on the neck, lots of texture on the neck, lots of hyperpigmentation on the neck, a little bit of scarring there as well. You see with an UltraClear treatment, it brightens the skin. It's able to get rid of this scarring here on the skin as well. And also, if you notice on the cheeks, there was some significant hyperpigmentation and acne scarring, a nice brightening on the skin here. Same thing here. We see an overall hyperpigmentation on the skin with lots of various scars on the skin, lines on the neck here with hyperpigmentation. We see some significant improvement as far as pigmentation is concerned and texture and quality and tone of the skin on the neck. This is a patient here who is looking for overall improvement in the texture and tone of the skin. So this is a very common patient we see that comes in and says, you know what, I just want my skin to look better. Old acne scars from years ago, but also looking to photo rejuvenate as far as anti-aging is concerned. So this is an going a little deeper down into the dermis, doing what we call a clear treatment, so a little bit more significant than the 3D Miracle. And you can see here improvement in the oiliness of the skin, improvement in the pores, improvement in color, as well as texture and tone. This is a darker skin patient. And we can see here a significant improvement in hyperpigmentation as well as the texture of the skin in these scars right along the lower cheek line here. And this is a pretty significant pigmented lesion on this patient's skin. This is the before photo. And you can see after 2 treatments with the clear, significant lifting and improvement of that pigment. This is something that a patient could be offered a surgical option for, something more aggressive treatment. But even with this laser treatment, she was able to get significant clearing here without any scarring. So that is a really pleasing result here. excuse me. Here we have a patient who has some melasma on the skin. You can see this mottled pigmentation. You can see not only on the lower cheek here, but you can see where it's moving on to the upper lip area here. This is 10 months after 2 treatments. Still not the most superficial treatment, just one step down, nothing too aggressive though, but significant improvement in that pigmentation in the skin. We all know from those of us who treat melasma and those of us who suffer with melasma, it is a very stubborn disease process. And there are certain lasers that will actually make melasma worse. Excuse me, it is good to know, and we found very good results as well, to know that there's a laser that can safely be used in melasma. We have patients that come in who've been suffering with melasma for years and they've had multiple treatments. Some have offered minimal or temporary improvement. Some treatments they've had have made them worse. We're able to now offer them this treatment that will give lasting improvement. They will need to do maintenance treatments to make sure that they are able to maintain that improvement, because we know that melasma is a chronic condition, but significant improvement here. And same thing here after 2 treatments. And these are oftentimes the patients that we will definitely combine with a very good aggressive topical skincare regimen along with their laser treatment. The hands are a very common place where people are looking for photo rejuvenation. We've actually treated a good number of hands for our patients. We want to rejuvenation our face, our neck, our décolleté area, but the hands are also a place that show age. The UltraClear laser not only helps us to get rid of the brown pigmentation on the hands, but it really does give some skin tightening. We know that as our hands age, that skin appears a little bit more wrinkled, a little bit more textured. It's always nice to get a little tightening along with improving the brown spots on the back of the hands. So we were very excited to be able to offer this as an option for our patients as well. Here, the under eye skin is very sensitive. It is, you really can't do very harsh or aggressive treatments here. And this was one of the areas that bothered me and was one of the reasons why I did the UltraClear on my skin. You can see just 5 weeks after one treatment, there is significant improvement in some of these very deep lines. And what I enjoy about this laser is, again, it is making your own collagen better. This is not filler. This isn't anything being added in. This is improvement of your own collagen, tightening of your own skin. And oftentimes after a patient finishes with a series of laser treatments, if there are other areas that we feel that they are lacking volume, or we want to do a little bit, get a little bit more improvement, then we can go back and say, okay, your skin has tightened as much as it can on its own. Now let's use a little bit of filler instead of a lot of filler. Let's make sure you maintain a very natural appearance. Make sure that you look as close to you as possible. We do our laser treatments first. We allow your skin to tighten and improve as much as it can on its own, and then we consider adding these other things in. And this is a representation. Let's just make sure we didn't skip anything. This is a representation of improvement of a traumatic scar here. So this scar is red in appearance. It's a little white. You can see a stark difference between the normal skin and the scarred skin. And over time, the scar is not gone, but with 2 treatments, it is significantly blurred into the background. And even when you cannot get rid of a scar, it is a huge improvement for a patient to know that that scar is not standing out as much. And with continued treatments, you can get even better results than we're seeing here. Now, this is going into customized treatments where a patient is not just treating pigmentation, but is looking for a little bit more improvement in laxity. We can see this patient has some jowling here. Someone may even consult this patient on something as aggressive as a facelift. But this is a result of this patient after one treatment. So this is one treatment with the UltraClear laser. This patient has experienced significant improvement with the brown spots. a significant improvement in her jowling here. And again, with repeat treatments, she's going to continue to see tightening and lifting and defining of this jawline. And same thing here, you see a significant improvement of the brown spots on her forehead and a significant improvement of her 11 lines between her brows there. So an overall excellent photo rejuvenation only 8 weeks after one treatment session. Again, here, a very aggressive improvement of the what we call the infraorbital creases or the crow's feet on the sides of the eyes as well as on the lower lid. This is a result that you would get from a very aggressive CO2 laser treatment that would give you a whole lot of downtime, or maybe even surgical intervention that would give you a whole lot of downtime. This is 4 weeks after one treatment. So this patient is seeing this kind of improvement within a month of one treatment. And any treatment that can hold off a surgical procedure as we're aging is definitely a great treatment to consider. So you see here, there's a brightening and tightening of the skin in this area. And there's an overall improvement in this crow's feet area. So just a win here. You're also noticing that there's been some improvement in that little bit of hooding of the lower eyelid there. And we can safely treat all of these areas with this particular laser using the eye shields to protect the eye itself. We can get pretty close around this eye area. Okay, here we're seeing a patient with acne scars, large pores, texture and tone. And this is 1 week post one treatment. So this patient is 7 days out from one treatment. We are seeing significant improvement in pores, texture of the skin. We're also seeing a little bit of tightening or smoothing as well. And remember, this patient is very early after treatment, so 1 week after treatment. We know that our skin remodels and turns over. So as this patient, in another month, in another month, in another month, we'll continue to see improvement from this one treatment. So the improvement doesn't stop here, it continues. Again, here you see all these little fine lines and so forth in the skin here, and some significant tightening 4 weeks after one treatment, and also improvement in the brown spots here as well. Again, here, same thing. Patient is getting some nice improvement in the brown spots on the cheek in this area, and also some improvement in the fine lines around the mouth. Here, patient has some significant brown spots and photo damage on the skin just from years of sun exposure. Also, some old acne scars. So this is when we have our teenage years meeting with our aging years. So this patient has acne scars, old acne scars, as well as fine lines and wrinkles as well. And this is the case for most of us. There are a lot of us who have old acne scars, and now we're at the age where we're also getting wrinkles as well. So this is actually a very common patient that we see who's coming in for improvement of something old and also improvement of something new. And you can see here, this patient has significant improvement in the jowling here. Okay, so nice lifting and definition of the jawline. This is less than a month after one treatment. Significant softening of the crow's feet here. And as you can see, these are very deep pitted acne scars in this area. Just with one treatment, in less than 4 weeks, you see significant diminishing of the depth of those acne scars. So that is a very significant improvement in less than a 4 week period of time. Now, this is a remarkable result. This is a patient that would typically be offered a neck lift. We would offer this patient a neck lift because there is excess or redundant skin that has actually flapped over here. And you see all of these fine lines, and you see this just network of little lines going back and forth here, just natural normal aging process over the years. After this is 1 month after the third treatment. So this patient has had 3 treatments. This is a month after that last treatment. And as I mentioned, After your treatments, you continue to see improvement. That collagen continues to turn over. Those fibroblasts continue to make new collagen, allowing that skin to continue to tighten. So this has definitely given a surgical result here. There was excess skin here that by any other means you would have recommended needs to be surgically removed. After three treatments, this patient has had a lifting and tightening of the skin here. So remarkable result with the UltraClear laser here. This is a patient with acne scars, significant kind of pitted acne scars in a type 3 patient who you have to be very cautious. You want to get in there deep. You want to produce that collagen, but at the same time, you don't want to cause hyperpigmentation or exacerbate any scarring. And you can see significant improvement in those pitted scars in just with just one treatment in 1 month's period of time. This is a patient who has some just normal photo aging, skin laxity, coming in for improvement in texture of tone. 4 days after treatment, little bit of pink left there. 7 days after 2 treatments, now we're starting to see it. Now we're starting to see some lifting of these heavy jowls here. Now we're starting to see tightening underneath these eyes, improvement of hooding on the sides here. So overall improvement of the texture and the quality and skin laxity 7 days after 2 treatments. And this patient will continue to get improvement. She will continue to see lifting of those jowls. She will continue to see improvement of those lines, those marionette lines around the mouth and so forth. And this is a cute little one who has a traumatic scar, coming in for some improvement of that scar. Treatment very early on after the injury happened. So you can see here the initial injury. After 1 treatment, some improvement here, but after 2 treatments, the scar is almost imperceptible there. So very excellent improvement with scarring there. And here we see a woman who's coming in. This is typical, just photo damage, a little bit of photo damage everywhere. So extending from the forehead, temples, the cheeks here, jawline, and also starting to get some little fine lines here. So this is a very typical patient we see. And this is 5 weeks after 1 treatment. This is beautiful lightening, softening of the skin, improvement in texture and tone. You can see that nice kind of shine, that glow to the skin that's there because all of that dull, damaged skin has been removed with the laser treatment. Again, here, a very remarkable improvement in the neck, the skin laxity here. This would be a patient that we would offer a neck lift to. But again, after 1 treatment, 6 weeks after 1 treatment, if you take a look here, you can really appreciate the improvement that she has, not only in her jowls, also in this what we call submental or underneath the chin area where there is excess redundant skin causing all of this wrinkling and rippling through here, and also all of these fine lines and texture around the mouth. This patient has improvement in each and every one of those things 6 weeks after treatment. We see that jawline coming in. We see that nice, sharp, youthful angle to the jawline coming back there, and a smoothing in the texture and quality of the skin. That's with 1 treatment 6 weeks afterwards. So you can only imagine if a patient like this decides to do 1 more treatment to this, they would really get a complete, almost surgery type correction here, and incorporating the right products, that would just be beautiful there. But that is an excellent result there. Younger patient coming in with pores, acne scars, and some hyperpigmentation. And if you can appreciate this here on your screen, these are very, very deep scars in the cheek here. This patient has experienced improvement, and also you see here that skin has tightened. If you can appreciate here, there's a little bit of laxity in this lower kind of jawline area here. There's been a tightening and lifting there, and you can tell that because there's a little bit more downturn here. That downturn is improved, and that cheek is lifted, and it's also smooth there as well. This patient here coming in for overall improvement, brown spots, fine lines, wrinkles. We have the lines at the corner of the mouth there. We have some downturn of the mouth as well, periorbital lines around the eyes, and we can see a significant overall improvement in texture, tone, and skin laxity here for this patient as well. Now, getting into the most aggressive of the treatments, which is laser coring. This gives you a brief video of what the laser coring is. So with the laser coring, we're treating specific vectors. We say we want to lift that skin in certain areas. So let's say we want to lift and tighten our jowls. We want to lift and tighten our lids, and we want to lift and tighten our jawline. So we can use that laser coring to be very specific in the type of tightening we get on the skin. This is one of our patients who got very beautiful results after treatment with UltraClear plus laser coring, significant improvement of this heavy nasolabial fold here with an uplifting of that cheek, a definition of the jawline through here. If you look very closely, lots of fine lines and brown pigmentation on that cheek, a nice smoothing here. And you can see still a little bit of redness from the treatment about 7 to 10 days after treatment, but a very nice improvement here. So improvement in jowling, improvement in the smile lines here, as well as improvement around the eyes and a little bit of lifting along the neck there as well. And here, another example of a patient with laser coring, significant improvement along the jawline here, improvement of the texture and tone of that skin on the neck, and then, of course, an overall improvement of the skin here with the brown spots, the fine lines around the eyes, the skin laxity. So overall improvement in texture, tone, and pigmentation on the skin. This is a patient, again, significant laxity through here. You can see that redundant skin almost folding over there. And this is after one treatment. And this is a patient, of course, we would recommend that she consider having more treatments. But you can see this big, heavy jowl here. So you'd really tell this patient, we don't have much to offer you other than a surgical option. But with the UltraClear laser here, you see that this jowl is starting to lift itself. And you see that this redundant skin has lifted to the point where it's not folded over anymore. And then you see where all of these fine lines here in the skin are starting to smooth themselves out as well. Again, here, necks are very popular. They're one of the things that a lot of us feel show our age. So we have a lot of patients who are coming in looking for non-surgical options for treatments to rejuvenate their necks. But you see here significant improvement in these fine lines. Actually, some of the fine lines and very, very deep lines as well. You can see improvement there and improvement of the overall skin texture and tone. This is only 6 weeks after one treatment. A patient like this, if they wanted to see more improvement with texture, tone, and tightening, again, we would encourage them to do more treatment sessions. But you can see just with one treatment, there's been lifting of this heavy piece of redundant skin here where the skin has almost folded over onto itself. There's been significant smoothing in that area as well. Again, very common. This is something that patients come in looking for improvement. May not have been a smoker, but they call these smoker lines. We call them perioral rhytids, so around the mouth area here. But oftentimes people will feel like this makes them look very aged. So laser options are always a good option. You're almost taking that laser and ironing out. Think of it as a curtain or a wrinkled sheet. We're using that laser to iron and smooth out. And you may notice here that with tightening and improvement of the lines on her upper lip, you also see some lifting of that lip. So as we age, our lips descend and they somewhat disappear. But with this laser treatment, she's had improvement of the lines. And with that tightening, you're starting to see more of that upper lip showing as well. So rejuvenation of the skin around the lip, but that has also caused some rejuvenation of her lips as well. And you can see improvement in these very, very deep lines around the mouth here. And this is only 6 weeks after one treatment. This patient did not have any fillers or anything like that. This is just what the UltraClear laser alone can do. Again, another example of a neck and jowl area. If you can see here, these very deep lines on the cheek and these very deep lines down here in the jowl, creating this redundant skin. 6 weeks after one treatment, you can see that the skin is still a bit pink, but significant improvement in these areas with a non-surgical option. And again, here, this is an example of eyes. Just like necks, we have a lot of patients who are very bothered by the appearance or the changes that they notice around their eyes as they begin to age. And this can start even in the 30s, in the mid to late 30s on up. We have patients coming in asking, what are my options? I feel like I look tired, and I think it's because of the changes around my eyes. And the UltraClear, and that this is one of the reasons I did my treatment as well, gives a very nice smoothing of this skin around the eyes. It helps to smooth all of these little fine lines in the crow's feet area, as well as the lines underneath the on the lower lid here. This is the improvement after 4 weeks with only one treatment. And it's great to be able to offer patients an option where they see improvement after just one treatment. So many things require so many treatments before you see the improvement. But here you're seeing the improvement after just one treatment. And we've seen that several times this evening as we've gone through our photos here. So that is it. So now you are fully educated on the UltraClear laser, and hopefully one of those slides and one of those photos was able to speak to you, and you say, you know what? That is something that I could really benefit from. I need that improvement. That's what I'm looking for. So we encourage you, if you're with us this evening and you're interested in learning more about the UltraClear laser, and if it is right for you, we encourage you to reach out to us and schedule a consultation appointment. And we can talk about options. We can talk about what you need, where it may help you, whether it may be the face, around the eyes, specific areas, if it's scars, if it's acne scars, if it's aging, if it's pigmentation. We know there's so many different options that can be treated with this laser. And I will turn things back over to Holly.
Awesome. Thank you so much, Dr. Maragh. That was fantastic. So yes, we do have a little promotion for everybody that's attending today. I did pop the phone number and the email address right in the chat. So feel free to copy those directly right out of there. So everybody that's attending will receive 20% off of their UltraClear packages. And if you guys are ready and on it, the first 5 to actually book their treatment will also receive 20 units of complimentary Botox. So that's a huge promotion. This is going to be our best promotion of the year. So definitely call and email and text as soon as possible and get on the books for that consultation. We do also offer care credit financing as well. So you can have a financing option with 0% as well. All right, let's go ahead and get into my favorite part, the Q&A. So there's quite a few questions in here already, so we'll just go ahead and get started with them. First question tonight is, does the UltraClear help with red or pink pigment and discoloration?
You will see some improvement in pink discoloration on the skin. There are other lasers that we offer to more aggressively address pinkness specifically. The UltraClear is going to really be geared towards pigment texture, tone. If the redness is associated with scarring, if the redness is associated with enlarged pores and things like that, you will actually see some significant improvement with the UltraClear laser. But if the redness is from the little broken blood vessels on the skin, what we call the telangiectasias, sometimes another laser treatment would be more appropriate for that. But if the redness is from rosacea or inflamed acne bumps or inflamed acne scars, you will see significant improvement with the UltraClear laser.
Awesome. So either way, come in for a consultation and we'll find a treatment that will work right for you. Okay, next question. Does clear or UltraClear help with dark circles under the eyes?
Both. So clear and UltraClear work for dark circles under the eyes. Again, that was one of the reasons I did my treatment. The excellent thing about the technology, if we think about the 3D Miracle in the clear and then going to the UltraClear, we are addressing that top superficial epidermis where a lot of that pigment hangs out. And then we're also addressing the dermis. Oftentimes when you get that darkness underneath the eyes, it's a shadowing effect. So when we lose some of our volume underneath the eyes, we create this sunken, hollow appearance underneath the eyes. So if you can imagine with the UltraClear technology, the Ultra component is going down into the dermis, it's creating new collagen, and it's lifting that skin up. So you don't have those indentations anymore. And that's what I noticed when I did my treatment. I felt like I didn't have those indentations anymore. It really brought that, tightened that dermis for me. And then on top of that, with the clear technology, it pulled some of that pigment off. So you can get a significant improvement in darkness underneath the eyes with the UltraClear.
Fantastic. Okay, next question. How long ago did you do your treatment and when are you going to come back for another one?
My treatment I did in March. So March 2025. So that was about 6 months ago. And prior to that, I did another treatment 6 months before that. And that was just kind of a little 3D miracle treatment I did on myself just to see and touch and feel. Anything that I offer to my patients, I always do to myself first. So that's when we were really first starting out. So I did that to myself. I will likely do another treatment to myself, well, probably around December time. I really like the glow that it gives me. I like the way that it makes it's all our goal to not wear makeup, right? That's what we all say. We all want to get up and go. I have 3 kids. I have a busy schedule. I work 12-hour days. I want to be able to get up and go. I'm in a surgery mask all day long. I can't have a thick layer of makeup on my skin, but I would like to look fresh for my patients. I would like to look fresh for myself and feel good about myself. I feel like with my 2 treatments that I've done, I've gotten to the point where I can be makeup free. I can wear my tinted sunscreen on my face every day and use that as my makeup, but I don't have to do the concealer anymore. I'm not caking on things to cover up darkness underneath my eyes. So I really like the fact that it's helped me get to the makeup free point. And I do also like the definition that it gives around the jawline, and it helps with the fine lines around the mouth as well.
Awesome. And your skin looks absolutely fantastic.
Thank you.
All right. How does this compare to CO2 lasers?
You can, as you can see from the photos, you most certainly can get CO2 results without the CO2 downtime, and also without some of the potential side effects that can happen with CO2 laser. Also, we're able to get CO2 results in patients who otherwise can't get CO2. So in our patients who have skin of color, they may be a type 3, type 4 patient, and CO2 might be off the table for them, not even be able to be considered for that. And definitely for our type 5, type 6 patients, we have been able to use this in our darker skin tones and get that aggressive tightening. We've been able to use it in our lighter skin tones and get aggressive tightening without the same type of downtime. That is from the cold fiber technology of the UltraClear laser, and also it has the advantage of this coagulation setting that minimizes the amount of bleeding afterwards. So that means that our patients have minimal bruising. They don't have the same amount of bleeding. So they're getting CO2 results without the downtime and without some of the potential risks.
That's fantastic. Okay, how long does it last if you have 3 treatments specifically for laser coring?
For laser coring, so, and this is a good thing again, we're not talking about something like Botox or filler. So Botox and filler wears off. We've made new collagen in the skin. So now this is your collagen for you to wear throughout life. So just like our skin normally ages over time, this new collagen is slowly going to age over time. The difference is now that you've invested and gotten this laser coring, you're using the right products. You're using the things to help you maintain this new collagen that you have. You may do the laser coring, and then a year or two later, you may do a superficial treatment. You may not need that laser coring again. But we always tell all of our patients, you get as many treatments as you need to get the result that you want. So everyone's skin is different. Everyone's result they're looking for is different as well. So let's say you do 2 treatments of laser coring. Let's say you do 3 treatments of laser coring. That skin is now tightened. You're not going to go sit in the sun like you did years ago. You're not going to go put baby oil on. You're not going to go to the tanning bed. You're going to take care of that skin. So that effect of that laser coring is yours, and it's going to last. So you're going to age out of that just like you would age out of a facelift or something like that. So that is a long shelf life. So we're talking 3, 5, 7-year intervals there. And then you're just doing your superficial treatments to make sure that your top layer of your skin stays fresh. But that deep dermal new collagen is yours now.
Fantastic. Okay, speaking of taking care of your skin, what does the aftercare treatment look like?
So we usually have an aftercare package, and it just depends on what type of treatment the patient is getting. So a 3D miracle treatment, you're going to go home. We use a biocellulose mask to cool the skin after the treatment. We give you a few of those to go home with as well, and those feel really nice on the skin, nice and soothing. Sometimes we combine these treatments with exosomes to get even more tightening of the skin and collagen production and things like that. But we usually have our patients use a gentle cleanser. We have them use a healing emulsion, depending on their skin type. It will vary which one that we use. And then we encourage them to use their sunscreen. So it's not a very aggressive multi-step post-care treatment regimen. It's very basic. It usually consists of a cleanser, a healing ointment, and then sunscreen.
Awesome. Perfect. I think that was all of our questions for this evening. So Dr. Maragh, thank you so much for taking the time to explain this fantastic treatment to us. I know I learned a lot. I cannot wait to get my treatment done. Really appreciate it. Everybody, as far as the next steps, what's next? Email, text us, go ahead and get scheduled for your consultation so we can build you a nice little treatment plan and get you glowing skin just like Dr. Maragh's.
Thank you. And have a good evening, everyone. Thanks for joining us.
Perfect.